Hello everyone, how's it going? The symptoms of menopause can actually be similar to the symptoms of those with thyroid disorders. So how can you be sure if you have one or the other, or maybe even both? Well, if that sounds interesting to you, then keep watching. Now, when people talk about menopausal symptoms, oftentimes they're referring to perimenopause, which is actually the transition time leading up to menopause. At that time, estrogen levels fall quite a bit, and studies are showing that estrogen may have direct actions in human thyroid cells. They still need to do more research to really understand that relationship, but it's definitely something to consider. Now, later in the video, we're going to discuss how some people may be like me. You may have already been receiving treatment for hypothyroidism well before you started into perimenopause. And we're going to talk about if that treatment might possibly need to change. Now, perimenopause usually happens between ages 45 and 55, and it usually lasts an average of 7 years. For some people, it can last 10 to 15 years. Now, the symptoms of this time period leading up to menopause can be very similar to the ones that people experience who have a thyroid disorder. For instance, those with hypothyroidism, which is the underactive thyroid, they may experience changes in menstruation, moodiness, forgetfulness, and weight changes. Those with the hyperactive or hyperthyroidism, that's the overactive thyroid condition, they may experience hot flashes, heat intolerance, palpitations, have a fast resting heart rate, and insomnia. Sounds familiar, right? But we don't want to assume that these symptoms are a result of perimenopause or menopause. Now, before we get into the danger of leaving a thyroid condition untreated and talking about how it's diagnosed, I'd like to remind you to please like and subscribe if you're enjoying today's video. I'd also like to remind you to open up the description box below. You'll find some links there where you may be able to get more information. Now, the danger in not treating or having a thyroid condition diagnosed is because thyroid problems can actually increase the risk of osteoporosis and cardiovascular disease, and so can menopause. So it makes sense that research suggests that having thyroid dysfunction can actually increase symptoms and complications of this process of menopause. Now, there have been people who've experienced some extremely difficult menopausal symptoms that were very severe, but once they received treatment for the thyroid, they noticed that their symptoms actually improved. Now, those of us who have already been treated for hypothyroidism before we entered perimenopause, we may actually have to have a dosage change. Sometimes we actually wind up, once those estrogen levels start coming down and fluctuating, there's a possibility we may need to have our thyroid medication lowered. We may actually need less thyroid hormone. Now, those who were being treated before perimenopause who are now using the estrogen replacement therapy, they may actually need a higher dosage at this time of the thyroid hormone. So, since it's possible to have both conditions at the same time and they can really cause our symptoms to be worse, it's very important to get an accurate diagnosis. The good news is that the doctor can actually use a simple blood test to diagnose either one, menopause or a thyroid disorder. He can decide, they can actually diagnose us or rule out one of those conditions or find out if we're experiencing both, and we can get the correct treatment. Now, while there's more research that needs to be done to understand how estrogen levels can affect thyroid hormone levels, there's one theory that this fluctuations in the estrogen levels actually can increase the inflammation, which can actually make it easier for us to develop an autoimmune disease, such as Hashimoto's thyroiditis, which can lead to hypothyroidism. So if you have any concerns, you definitely want to express those to your doctor. Make sure you're getting your blood work done regularly and maybe even more often when you're going through this time period to make sure you have those levels at the correct dosage for optimal health. Well, I hope you've enjoyed today's information, and I hope to see you in the next video where we'll discuss another way we can improve our health.